All right, you asked and I listened. I have some work from home jobs you've been asking for, including data entry-level healthcare jobs, some easy HR positions, and more. So let's get right into them. So I want to start off with an HR position. This one comes to us from a company called Chain Guard. They have an opening for a people operations specialist. This one is full-time remote anywhere within the United States. And what you're going to do is help streamline and optimize processes, maintain scalable systems, and ensure compliance in an ever-evolving landscape. So basically, you'll run the onboarding, transitions, and offboarding logistics, coordinating steps across teams, managing documentation, and keeping workflows organized and on track. You'll be the first point of contact for employee questions, providing responsive, high-quality support and improving moments that matter across the employee journey, while continuously improving and optimizing people ops processes and systems to ensure efficiency and scalability. So that pretty much sums up what you're going to do on a regular basis. They have more details. If interested, go ahead and read through the details. And what they want from you is 2 to 5 years experience in HR, people operations, or a similar role in a high-growth environment. You have proven experience with HR systems and a passion for leveraging technology to streamline processes. You have a solid understanding of employment regulations and compliance requirements. You also have experience supporting global teams. And then, of course, you need your typical soft skills. And I'm just going to scroll down here to see if they tell you. Yep, right down here, they tell us they'll pay between $72,000 and $85,000 per year. So our next HR position comes to us from the company Regis. So Regis is the parent company of several other what I'm going to call manscaping companies. That's kind of funny. So this job is for a human resources coordinator. It's full-time remote, but as we scroll down a little bit, they tell us this is a remote position. You do not have to be located in Minnesota. That's where this company is based, but they do want someone located in the Central or Eastern time zone. So this is your typical HR coordinator position where you'll provide administrative and operational support to the HR team, including onboarding, record keeping, scheduling. You'll maintain employee records, as well as process benefits and assist with employee communication. So yep, your typical coordinator kind of position. They have more details as far as what you're going to do on a regular basis. If interested, read through the details. They prefer but don't require. They prefer you have a degree in human resources or business. SHRM-CP or PHR is a plus, and they want you to have about 2 years experience in human resources or an HR assistant position. You also have experience working with large employee populations. You have experience with onboarding, offboarding, and maintaining HR systems, and then you need your typical soft skills. And we can see right here on the job description, they tell us they'll pay you between $50,000 and $60,000 per year. So now we're going to talk about some work from home healthcare jobs. I have a couple very entry-level positions, but the first one I'm sharing is a little more upper entry level. It comes to us from Blackbird Health. This job is for an insurance operations specialist. It's full-time remote anywhere within the United States. And what you do is expertly manage the complete life cycle of insurance operations, including verifying patient benefits, securing necessary pre-authorizations, and ensuring strict adherence to all payer guidelines. You'll serve as a primary liaison for insurance inquiries, and this position is crucial in maintaining a positive patient experience through accurate and timely benefit management. So yeah, you'll verify insurance coverage, eligibility, and benefits for new and existing patients. You'll call insurance companies to confirm coverage and resolve issues related to pre-authorizations, referrals, and claims, and serve as a point of contact for patient questions about insurance coverage, copays, and billing. You'll also manage and track pre-authorizations, support patients and other Blackbird departments, and provide exceptional customer service by actively listening to and addressing patient concerns. So I noticed up here they tell us you need a deep understanding of CPT and ICD-10 coding relevant to medical billing and claim submissions. You can resolve complex claims denials and manage accounts receivable effectively, and you have a thorough comprehension of various insurance plans, including HMO, PPO, EPO, and government programs. You need 2 to 4 years of healthcare billing experience working with insurance companies and EHR and PM systems such as Athena. They want you to have 1 to 3 years experience in a customer service setting. You have experience with insurance eligibility verification and benefits determination. You're familiar with securing prior authorizations and referrals for services. You have knowledge of medical billing and insurance terminology. You can maintain confidentiality according to HIPAA regulations, and you have reliable high-speed internet access. And as far as the salary, down here they tell us they'll pay you between $25 and $28 per hour. Okay, so an entry-level healthcare position comes to us from SCA Health. This one is for a patient financial specialist. It's full-time remote anywhere within the United States, no location restrictions, and it looks like they have 2 openings for this position. And you probably notice the salary, which is between $21.50 and $23.50 per hour. You'll work Monday through Friday. Your hours will be between 7 a.m. and 6 p.m. Eastern Time, which translates to 6 a.m. to 5 p.m. Central Time. You don't have to live in the Eastern or Central Time zone. This job is fully remote anywhere within the United States. Just translate your local hours to those hours. So what you're going to do in this job is verify patients' insurance coverage, ensuring that the practice has the necessary information to bill correctly. You'll communicate with insurance companies to resolve any issues or discrepancies in coverage and help patients understand their insurance coverage, including what is covered, co-pays, deductibles, and out-of-pocket costs. You'll receive and process insurance information and forms from patients and insurance companies, establish payment arrangements, and discuss any outstanding patient balances with patients. And last but not least, you'll serve as a point of contact for patients with questions about their bills, helping to clarify changes and provide detailed explanations of the financial aspects of their care. And for this job, they want you to have a high school diploma or a GED. They'd like you to have previous healthcare experience, and they're not saying how much of that experience they want. You're familiar with co-insurance, co-pays, and out-of-pocket costs. You're an excellent communicator, you're comfortable using computers, and you're also familiar with Excel, Word, and RCM systems. And again, they tell us they'll pay you between $21.50 and $23.50 per hour. We have another entry-level healthcare job. This one is with Isaac Health, and it's for a care navigator. This one is full-time remote anywhere within the United States, and they tell us right here they're looking for someone who has prior experience coordinating and navigating care for patients, caregivers, and their loved ones, and you get bonus points if you speak Spanish. But don't worry, that's not required. So what you're going to do in this job is answer inbound calls, emails, and text messages from patients, caregivers, families, external providers, and other facilities. You'll schedule and maintain contact with patients via phone or email, and explain health insurance benefits and eligibility to patients, and process co-pays and co-insurance as needed. So that's the gist of what you're going to do in this position. They have more details. If interested, go ahead and read through the details. And scrolling back up to the top of the job description, they tell us they'll pay you between $40,000 and $45,000 per year. So here's an entry-level-ish customer service position. Fubo has an opening for a Tier 2 customer care representative. This job is full-time remote anywhere within the United States, no location restrictions, and they'll train you in this job. So what you're going to do is deliver world-class support and build customer satisfaction and loyalty by handling all inquiries regarding Fubo's service and customer subscriptions over the phone and email. Basically, you'll provide effective and timely resolution to a range of customer inquiries from billing, technical, and social media, and you should strive for a one-call resolution of customer issues. You need a high school diploma or a GED. You can speak, read, and write professionally. You have experience handling advanced customer care contact escalation from tier agents. You also have experience with social media platforms, managing posts, and engagement. And then you need all your typical soft skills you need for just about every job. And when it comes to the salary, scrolling down to the bottom of the job description, they tell us they'll pay you $22.50 per hour. On to the data entry job. This one comes to us from Ascension. This job is for a payer enrollment coordinator. It's full-time remote anywhere within the United States. You'll work from 8 a.m. to 5 p.m. Central Time Zone hours, and you do a whole bunch of data entry in this position. You'll populate necessary enrollment fields in MD Staff for newly credentialed providers, and MD Staff is a software program they use. I have a pretty good feeling they'll train you on that. You'll ensure provider files meet managed care criteria and send newly credentialed rosters to all delegated payers. You also complete and submit applications for all non-delegated payers, process provider data updates, changes, and terms in the system, and submit to payers on a monthly basis, and follow up with payers to ensure new providers are loaded timely and correctly. And they list more details. If interested, read through the details. They want you to have a high school diploma or equivalent or 1 year applicable cumulative job-specific experience. And they tell us right here, required professional licensure certification can be used in lieu of education or experience if applicable. And going back up to the top of the job description, they tell us they'll pay you anywhere from $38,937.60 and $52,686.40 per year. So that's all I have for you in this video. Hopefully one of these jobs works out for you. And if you're looking for more work from home opportunities, you can find some in this video right here. Thank you so much for visiting. I truly appreciate your support, and I'll meet you on the next job lead.